So welcome to Vegas Circle with Paki and Chris. And today, joining the circle, we're excited to sit down with medical doctor and CEO of Sunny Health DPC, which she has a medical care that's gaining a lot of momentum across the country, which is a flat rate monthly fee that we're going to get into today. So we've got Dr. Lee. So thanks for joining the circle.
Welcome.
Oh, thank you. Happy to be here.
Yeah, so we want to kind of just jump right in. Were you originally in like a traditional medical practice and then you kind of got into direct primary care, or how did this all come about? Because it's very interesting for us. Yeah.
Yes, I graduated from family medicine residency, and I did a year of fellowship in women's health. And right after that, I got my first job in Las Vegas as a primary care doctor in a large medical company. And I was working fine employed practice for about 3 years. And it came to a point where my schedule was getting very difficult for myself to take care of 2 children. And really, I didn't really understand the model where I had to see so many patients. And I didn't feel like I was doing a great job. And at the same time, I happened to had gone to a conference, which was a direct primary care conference in another state. And I was just shocked that this model could exist. Yeah. So when I came back to my job and I found myself somewhat unhappy, I thought that I could maybe try this and give it a shot.
Yeah, that's very interesting to be able to do it. And we'll kind of get a little bit sidetracked, but basically you started your practice about 3 years ago, right?
Yeah,
which is Sunny Health. Okay. What was the original goal of when you opened that practice?
I think my original goal, and it still is that I want to make healthcare affordable and accessible.
Yeah. And that's short and sweet. I mean, that's straight to the point. And that's the biggest issue that we're seeing right now. And there's so many practices taking advantage of a lot of their patients and co-pays and all these different things that you have to do.
Right.
And I think it's one of those things like, this is a big problem. Everybody talks about it. You know, insurance causes prices to increase and then it gets kicked back to us. But when the insurance is getting those incomes, is this business model like as profitable as a kind of a standard primary care facility, or is it a little bit different where you have to kind of, make a little bit less, for lack of a better term?
Actually, during the pandemic, I worried too because I had my practice open and I went through the pandemic and we are still in pandemic, right?
Yeah.
But this model really did well. I doubled my patient panel every single year.
That's awesome.
And I think what happens is that patients get very personal with the physician and they know them. And the fact that patient could access me by text message, even phone, email, directly to me, they feel at ease because they can contact me when they're not feeling well. For myself as a practice owner, I'm not having to do like typical fee for service where I'm only making the income based on how many patients walked into my clinic. It's a membership. So every month I have a flat, somewhat of a stable income, whether I saw one person or not. I could have seen hundreds of patients, but it doesn't make a difference to me in terms of my income.
That makes a lot of sense because I recently went to the doctor and it seems like that's exactly what they're trying to do. They're trying to bill as many people as they can. And you can see they have no time. They're probably 3 or 4 patients in one different room and they're trying to hit everything while the nurses are talking. So it's very hard to be able to make it work for your stress level too.
Right.
Yeah.
And typically, we were seeing patients scheduled about every 15 to 20 minutes a patient, right?
Okay.
In an insurance model, right? And that just gives a physician about 8 minutes to see the patient if everything went smooth.
Wow.
But usually patients are in the room already late. I'm behind already. So
100%. Yeah. Every time you go to the doctor, you're waiting for 45 minutes or an hour.
Come in for a minute or two, and then that's it.
Yes. So I didn't really feel that was the model that I wanted to be in because really it does take some time for a patient to ease up to me, ease up in any situation.
Sure.
They're talking about some things very personal. It's hard to just sit down and start talking about depression.
Very good point. No, very good point. And you want to get comfortable with the person.
Right.
So your goal when you're meeting with your patients, do you have a set time or that's not, you're there to fix the issue or help them with whatever problem that they've got?
Right. So when I first establish new patient, I usually take out about an hour per visit. My schedule is hourly. But, if I know the patient really well, if it's a follow-up, I could fit someone else in the middle. Again, I don't get paid per how many patients I see, but I'm very hands-on kind of person, so I end up seeing a lot of patients where I could have just done a telemedicine. So my schedule is full, but my schedule is maximum maybe about 15 a day.
That's awesome.
Versus I had been scheduled about 37 in my previous practice. Usually I take about an hour for new patients, but really if I had the time and somebody needed my care, I could spend more than that.
Yeah.
Interesting. So is this different model than telemedicine? Am I understanding that correctly?
So this model, I really do everything. I have a platform for video conference where I could do sort of like a video meeting with the patient if they want to show me a rash. I also have, they could contact me by phone. So I do telemedicine in that sense with my patients. I don't just have unknown patient contact me.
Okay.
My patients could text me directly. There is no filter. So there's many ways. I see them in person as well. So I really have many access.
So it's like a hybrid model, and it actually seems to me from a customer standpoint to actually be a much better experience.
I think that word you said is very, very interesting and very good, because in medicine, when I was in employee practice, I never felt like my patients were customers. And in true sense, they are my patients. My patients are the paying customers.
Yep.
And in this model, I really was able to direct that the focus is on the patient. The insurance is not the one that's paying me. So I really try to pay attention to whoever that's paying me for the service, because that's why I'm there.
And that is, it's kind of almost feel like you're going to be able to give a better, like you said, experience, because you're not necessarily trying to identify something to pitch a specific prescription or something like that. It's really developing what the needs of the person is and kind of facilitate it that way.
Yeah, I'm on your side. I mean, I really see my patient for the first time, and I really do tell them I'm on your side. I'm not here to go against what you say or prove you wrong. I like to hear what you have to say.
Yeah. How does that work? Like, say, for example, I recently had to go to the doctor. So it's like you pay a membership, but do you have to, like, let's say I just want to go for a specialty service. Yeah. Whatever that is, like you said, a rash or a mole or whatever it is that I'm looking for, or to get taken off or whatever it is. Can I just go for that service and pay for it out of pocket, or would I have to be part of like the membership payment, per month, like you mentioned, like maybe a fitness, a fitness club?
Yeah. So the way it works is my practice is run I don't take insurance for my practice. Okay. But I have many patients in my practice who have insurance. So if they have insurance, I could refer them to specialists they like to see in their network. Got it. If the person is not insured and they want to see a specialist, I actually have developed over past 3.5 years many specialists, almost all specialists, who take cash for the services. And we had to negotiate some of them. But we do have that offer to people who have no insurance. And because of my practice where I have the time and, I have the interest, I do a lot of procedures, like the dermatology procedures that you mentioned. Yeah. We do usually in-house. Like I charge for the biopsy usually about, $45 to $75.
That's very reasonable.
And we take it off, we suture it, we send it off, patient find out what's going on.
Excellent.
So we do a lot of procedures in the office at cost as well.
Yeah. Do you feel like when you kind of got your business out there that you start getting this buzz where people it's almost like they want to put the marketing for you not to succeed, because that takes away the whole business plan of what the traditional.
That's what I was going to ask too.
Yeah,
you see a lot of pressure from like insurance companies to kind of push the business model away.
We're so small, and so I don't think they even know we're here.
I think you're gonna blow up, though. I really think you're gonna blow up because that model.
But I have seen something like a hybrid, some of this membership model, like popping out at some university programs where they're kind of testing it out. Okay. But nobody has bothered us or had any concern. I mean, really, we're talking because the quality of care that we're providing, I'm not going to be taking on alone as one practitioner, like 1,000 patients. There's no way.
Yeah. You don't have the bandwidth to kind of do that.
Okay. Whereas when I took insurance, I had about 3,000 patients, roughly. right?
That's
So,
crazy.
That's crazy.
so it's a little different. Like I wish more doctors did what I do, and I that's one of the reasons why I'm on this podcast, because I like to have other doctors to have the courage to jump out and maybe consider opening an office on their own.
Yeah.
Because more doctors could do this, it'll be much better for more people.
Is your goal to kind of have like a franchise model too, where you've kind of got your business model and then you have little subsidiaries that kind of would build this type of brand or type of business?
So I think direct primary care doctors are like very hands-on, right? So if I found, it had to be that I found the perfect doctor who would practice exactly the way I would do it, then I have interest to have somebody working with me. But I probably couldn't just hire someone just because they like the hours and lifestyle. So right now, I don't have any plan to branch out, but you never say never, right?
Yeah, you never know, because something might come your way and you never know. Yeah,
Right.
Yeah. So as far as kind of how like the discounted rates work, how do you work out like labs and like, radiology and things like that? Do you kind of send that out to other partnerships and medical, people that are in the community, or how does that work in your plan?
So let's say like somebody had insurance, because
Okay.
I do have patients with insurance. If it's easier for them to use the insurance and have a reasonable copay, I could order through insurance. But
Okay.
let's say that somebody had very high deductible insurance, so it's not really that useful, or someone who had no insurance, then I actually have network in town where I could do at cost for labs and imaging. So for example, like x-rays that I order, that patients pay directly to them, it has nothing to do with me. It's about $20, $30, $40, depending on sites.
Okay.
MRI 300, CT scan 150. That's sort of an average. So often it's cheaper than copay. So people with insurance actually prefer to do this. Labs, they come through me, so I have I have my account through local labs, and it's a discounted price. So annual blood tests where I check hemoglobin A1C, like diabetes, cholesterol, kidney, liver function, screening for thyroid, check for anemia, it'll be $30. The patients pay,
excellent.
right? It's itemized. So if I ever have to repeat just cholesterol 3 months later, it'll be $5.
Oh, wow.
This is
And how is that-
absolutely awesome.
Yeah, how is that different from like, say I don't have insurance and I go to a different doctor's office? Like how much would I pay in that circumstance where maybe they don't have these at-cost procedures?
Well, I mean, it's very interesting because one of my patients, young patient, I guess he had a little extra alcohol, fell and cut his forehead, and he didn't contact me. His friend was so worried, took him to emergency room.
Oh, wow.
And he got a very big bill, and he showed it to me. And I'm like, hey, like, I wish you just contact me. I probably would have told you go to urgent care if I wasn't available. And that may have been a better option, but he got a bill about $6,000.
Oh, wow.
And when I looked at the itemized cost of that bill, what you're saying about, let's say, like the cholesterol, like, let's say a CBC or a lipid, right? They were charging about $500. And I didn't know exactly where it was coming from. But, let's say as an individual patient going into an outpatient lab place and you want to just pay for that, probably it could be about $50 to $70, maybe. So through my account, or a doctor's account where it's discounted, it'll be much more inexpensive.
Interesting.
I love the transparency. There's no,
Yeah.
most medical practices, they don't give you that transparency. It's like stuff is written and you charge,
After
all
the
these
fact.
extra, after the facts and all these extra things where you're giving it to them straight, which is awesome. And you're working
Isn't it-
directly with you.
Right. But isn't it interesting that they don't offer this like transparency in medicine? Don't you think
Super
it
wild.
is a place where we need to know?
I 100% agree.
Right.
Yeah, because you want to know what you're paying. It's like
Exactly.
when you pay a bill, you want to know, like, okay, what is this?
In
Yeah.
every other situation, you get that transparency with the exception
For
of
sure.
the medical field, which is very odd.
Yeah. I mean, have I not encountered in my medical practice where like insurance model, right? And patients, I suggest them things like, hey, I think you need an MRI, where they would just give me this look. And I know it's not because they don't like to get an MRI. It's more like from cost standpoint. They just don't know. I have encountered this in other times. Like
Sure.
they're worried about cost, but they won't
I think we
tell
all
me.
are.
Yeah.
That's the first thing you're thinking. Like
Right.
the $6,000 bill at emergency room, people
Right.
will not want to go because they're worried about the bill.
It was discounted at. It was discounted, and it was still $6,000.
Oh, wow.
That's crazy. Yeah. Because that tells you a lot. Because, I mean, that's one of the biggest things. Like, I've seen it multiple times where folks, they do not want to go to the doctor because they worried about whatever situation, but they're really worried about what the cost is going to be.
Especially if they don't have insurance. Then it's almost like you're never going to go to the doctor.
Yeah.
Right.
That's amazing.
They don't, I think they lack the trust.
Yeah.
Right.
Yeah.
And that's unfortunate.
And they don't know, because I feel like even if I just go to the doctor and I don't necessarily know what's wrong with me, I'm going to get evaluated. If I don't have insurance, I don't know before I do the evaluation what my cost is going to be. So it's almost like a gamble every time. Is it going to be a $50 deal, or am I going to be out for $5,000? I have no idea.
Right.
That's scary. It's a scary. This adds more anxiety to what you're dealing with. So, yeah, I'm glad that you're doing this with Sunny Health. Just backing up a little bit, just with us being a business podcast. Did you have to take any like general business classes that kind of prepared you to build your current business now, or?
No, I didn't, because I went to the conference and it taught me a lot of stuff.
Sure. Yeah. you literally threw yourself in the fire.
Yeah. It gave me confidence because I saw other doctors just like me open practice and they're doing fine. And I think the confidence is what kind of helped me. And I started reading some books, but I'm not very smart, like business sense.
Okay.
But this model is simple. And I think that's why most doctors will succeed. Yeah. Business has to be simple for it to succeed, right? And this model is simple. I did not have to take a loan to start the business. I borrowed $10,000 from my husband, my family account, and I paid it off within 6 months. And I have no loan for my business. I have zero loan.
Yeah, that's absolutely awesome.
Right. And you asked me about my income, and really, year 2, I made more than what I made in an income practice.
Oh, wow.
So right now, I definitely make more than what I made in my previous practice.
So from that standpoint, it seems like a successful business model, like even just from being a standard, practitioner.
Yeah, I mean, everybody could do the math, and really, if I say 500, and average we charge $75 to $85 per month, we make pretty decent money, but we provide a good service, and that's why a lot of service that we do in the office we do not charge, like EKG. If I needed to do a breathing treatment, if I had to suture emergently, somebody got a cut, we don't charge for those.
Is it like unlimited? Like if I just want to every day you go and do a checkup? Is it?
Yeah, how does that work? Like you have a limited time that's in that membership, or?
Well, it is unlimited in a sense. You could see me if something was going on, but that's where the trust comes in, right? I know there's nothing wrong with you. I will not see you again for a while.
Okay.
I have patients.
So you're bold with it, like, look, call me next month. Yeah.
Right. I have patients who haven't seen me for 6 months, but they're paying the membership because they know that if something happened, they could contact me. And I have patients, I see them 3 times a week. I mean, it depends.
Okay.
And what do you recommend? Do you recommend this as like a supplemental plan with insurance, or do you recommend it as a instead of insurance? Because it seems like there's benefits to kind of the hybrid situation, even from a customer standpoint, where I have my insurance for larger expenses, but this for more of my kind of daily care needs.
Right. So, I have patients who have no insurance. So this could be the plan, the healthcare that they have, right? But I also have patients with high deductible insurance plan where they have insurance, but it doesn't really help them too much. And I have patients who are well covered, but they don't really have the access, right? So they still join our practice. But I want to say I encourage patients to have mostly at least some coverage for catastrophe things, right?
Okay.
But this is really having a doctor and getting a primary care doctor. So even if you had insurance, I become your primary care doctor. So this is a program, finding a primary care doctor that offers this access. And that's what it is. So really it could fit into whatever all the things that you mentioned in the scenario where someone may have a high deductible plan or someone may have very good insurance. But it really does kind of fit into all ways.
Oh, yeah, that makes sense.
No, it's great. I really enjoy, what you're saying. It makes a lot of sense. What do you enjoy about building like a small business in a metropolitan city like Las Vegas?
At least for healthcare, right? Patients have very little expectation.
You said they have little expectation? Yeah.
Right, in Las Vegas, because they got burned a lot in the healthcare, right?
That's funny.
So it's fun when I see that they're excited. about their own healthcare. They feel like they get some control.
Yeah.
And I like that. I like that they feel like they got it and they're going to live a healthy life. I think that's good. There's a lot of optimism in the city. People are very receptive to new ideas and they're open. And, fortunately and unfortunately in healthcare, like there's not many options. So when they see this kind of model, they get very excited.
That's cool. Yeah, Vegas is such a cool,
It's transient. And if you don't like how it's set up right now, give it 5 years, everybody will be new.
Change, yeah. Something new. What's some business advice or a nugget that you could provide somebody that wants to start their own business or they're just dealing with a lot of adversity? We've been dealing with a lot of challenges with everything that we've been dealing with the pandemic and the whole nine. But what would you share with them as far as a business tip?
Well, I'm just very flattered you asked me that question because I never thought anyone would ask me that kind of question. But I would say, especially if you're not experienced like I was, right? It's not a bad thing to start small. I mean, like I said, take out a smaller loan, maybe a smaller space, maybe share a space, but really a smaller scale, but make your business simple. And I think that is very important because people get simplicity. And if you, as a consumer, get it, then, that's good.
Yeah.
Yeah. So that's what I
remember
would say.
reading, John C. Maxwell.
Yes.
I remember reading his book, multiple books, and I love the simplicity of it. It's like everybody else tries to make it so hard for you, but the simplicity just works. And it makes a lot of sense on what you're saying.
Yes.
Yeah, for sure. That's great. Just kind of transitioning a little bit. Favorite restaurants, we always ask everybody in Vegas. What's your favorite restaurant here?
I know this is a very difficult question, right?
Yes, too many choices. Yeah.
Yes.
Yeah.
I like island style. It's a Korean hole in the wall kind of place.
Oh, where's that located?
Yeah, where is that?
What street is that in Chinatown? Like somewhere around Chinatown.
Okay.
Island style. They have two locations. There's one in Green Market, there's a Korean market.
Okay.
That's a
sounds
franchise.
fantastic.
But they have the original one on
Okay.
I think Spring Mountain or somewhere like there.
Check it out. I don't think anybody said anything about island. You said it's called Island Style?
Yeah.
Okay, excellent.
Yeah. It's
Two
kind of
locations.
like very like homey Korean food.
That
Okay.
sounds fantastic.
Yes.
I'll try that out.
I definitely would
That's
check
more
that out.
along, usually Paki's like STK, and I like the smaller spots, the home style food.
Yeah.
That's my.
Yeah.
We just went to, I do have to say that again, which was very good. I can't think, what was it called? Pepper, say it. Just say it. Pepper steak.
Pepper steak.
Have you been there before?
No, it sounds very good.
Yeah.
Capo brought it up. Excellent.
Really?
I just
Okay.
went there. Yeah, just really just, yeah, it was excellent.
Paki's very
I'm gonna
good.
check it out.
Yeah, it was very good. What else would you want to share? Anything that we forgot to ask you? Anything that you want to share for us that could be a benefit or what you want to bring up?
I want to just really one of the reasons why I did, I was very excited about to be on this podcast was because I like patients to feel like they have some control, they have options. And I told you, there's people in my practice who are very doing well, have great insurance, but also I have patients who have nothing. And I just want them to know that there is health care, and they don't have to join particularly my practice, but there's direct primary care, and there's many offices like mine that possibly is opening, and there's what already opened, that they could seek as option for receiving the necessary health care. And because sometimes you can't wait. Some things had to be dealt with in healthcare right away. So that's why I'm here.
We appreciate it. Isn't it?
No, honestly, it's an absolute pleasure. I'm glad you reached out and we were able to make this happen. Where can people reach you guys at for like your social handles and things on those lines?
Yeah, so my website.
Yeah, website or social handle.
Yeah, so www.sunnyhealthdpc.com.
Okay, awesome.
I think that would be the best place, and I do have a phone number on there.
Awesome. They'll be able to reach out. Well, honestly, Dr. Leo, it's great to have you on and
Thank
be able
you.
to
It was
share the
so fun.
simplicity. Yeah, you make it so simple and it makes a lot of sense for people, and hopefully people reach out to you and be able to use your services.
Thank
so
you.
Appreciate you. You can reach out to us at thevegascircle.com. So thanks a lot.
Awesome. Thank you so much.
Thank you.